area is common in our country, especially during the monsoon season. So today we'll be talking on this, why malaria still matters today. Uh, Many countries there is no malaria, but India still malaria is there. What is the cause? How it transmits? We feel mosquito is the reason. Mosquito is the vector, but some other thing is the cause. We'll be talking on those part. What are the symptoms? So we can make out this fever maybe the malaria, or this fever maybe the dengue, or this fever maybe the typhoid. Though definitely we need a blood test. But what are the symptoms which support the diagnosis of the malaria, and what are the danger signs? Means there are some complications which can happen. If these complications can happen, then patient needs to be admitted to the hospital. So what are those danger signs? And diagnosis, because any fever, we know typhoid, dengue, malaria, how to confirm it, we need a blood test. So when to get blood test, this is the important part. What blood tests are there, which I'll be talking of this. Just a little bit of basics of the treatment part, and then can we prevent it through personal protection from the mosquito bite or the environmental community prevention strategies. These all will be talking today. So if we talk why malaria is important, especially in India, if we say India had nearly eradicated malaria in the 1960s, way back, but it came back strongly by the mid 70s again. We are aiming to reach it, indigenous malaria zero incidence by 27 and full elimination by 2030. But these are the very high standards we can say. Still 26 is there, and 26 has started. Yes, malaria cases we see generally by May, so we'll come to know how many cases are occurring in 26 and then what is happening later. And to a surprise, more than 100 countries have already eliminated disease, and India's name is not in those parts. But there are countries, South Asian, which are very small countries like Sri Lanka, Maldives. They are so much dependent on our country. But if we say from the health angle, from the malaria angle, they have eliminated this disease. So it's not that we cannot eliminate the disease. We can. Yes, it remains here in our country, but important thing is we have done a lot of things. So it's a key contributor to deaths from infectious disease in India, particularly among young children. Mortality of has reduced substantially. Malaria cases we see, but mild case of malaria we see. So mortality is very almost minimal or less. However, if we say India has made a progress in reducing the malaria cases and deaths, but the improvement is variable across states. As we know, even in different states, we have a different health indicators. Here again, we have a different part. And malaria is not evenly distributed across India. When we say the 80-20 law, if that applies here also. So Pareto law of 80-20 here, it means 80% of the disease burden is concentrated in 20% of the population. That is a high risk. So we know who are those high risk population. So if we need to take prevention part or control part, definitely we need the measures, and we take measures there first. If we talk of the different states, as he said, Chhattisgarh, Uttar Pradesh, Gujarat, they contribute to nearly half of the malaria cases. And incidence rate were highest in Mizoram and Chhattisgarh, where if you say 1 in 50 people contract this disease, so high. Then Jharkhand, 1 in 100 people, and regions with high tribal population especially, they are disproportionately affecting 32% of the malaria cases and 42% of malaria death. See, important part, they are making 42% of the deaths, malaria deaths, while their population is only 6%. So these are the areas where we need to take action in a delayed manner. And malaria is driven by unique challenges here, because we can't reach to the forest area, hilly area. The healthcare is very limited. Parasite, mosquitoes is proliferating because of the climate, the water, storage of water like this. So that is the difficult challenge with us. So this is about the incidence in malaria, in India. Still, we are fighting with this malaria part, and we have not eliminated, though in the world many countries have eliminated. So what is a malaria basically? It's a life-threatening disease because it may lead to complications that may lead to the brain infection, anemia, sugarless, for many things. It is caused by a parasite which is called a plasmodium. So plasmodium is very, very tiny, tiny parasite which transmit through the bite of infected female Anopheles mosquito. So mosquito carries that parasite actually. Mosquito bite leads, it's not the mosquito bite, it is the bite of a mosquito which has these parasites. So infected mosquito can spread this infection. Now, people feel why only the female Anopheles mosquito it spreads? Why not for the male? Actually, if we say only the female Anopheles mosquito does a bite to the human beings, the male Anopheles does not bite to the human beings. Again, what's the reason? Because the female needs a human blood for ovulation. So for continuation of generation of the mosquito, the female requires the human blood. That's why female Anopheles mosquito does the bite to the human being. And because they are infected, so they pass on the infections to the person. Stagnant water serves as a breeding ground for mosquitoes. So more the mosquitoes, definitely chance of spread. Now, parasite cannot enter in our body directly. Parasite generally enters through the mosquito. So if we can prevent the mosquito bite, then it means we can prevent the malaria. And the highest incidence of cases, if we say they are occurring in the country during the rainy season from July to November. Generally, now the rain pattern changes. Even if we see this year in the north region of the India, basically what we are seeing early rains during the March. And so even the season sometimes start from the April end or May also. So this is the part, yes, it is related with the monsoon. So because of the water stagnation. So as we said, malaria is caused by a small parasites which are there inside the mosquito. This is called plasmodium. So they are the real culprit for causing malaria. There are different species, Plasmodium falciparum and Plasmodium vivax. Now in India, vivax is the most common. That leads to mild case of the fever and mild case. While falciparum, which is not very common, but that leads to severe illness, that leads to the brain infection also. And if falciparum is picked up on the blood test, then generally we ask patient to remain in the hospital so that if any complication occurs, so we can diagnose it early and we can manage it early. So malaria is caused by Plasmodium, more commonly in India by Plasmodium vivax, which is a benign form or a milder form. So this is the life cycle of the malaria basically. If you remember, we said first infected mosquito means it has the parasite has to go inside the mosquito. Parasite is there inside the mosquito, then it infects the person through the bite. When the mosquito bites, it first takes out that the saliva of the mosquito along with this the parasite plasmodium, and that plasmodium enters into the human body, and from the human body it goes to the liver, remains in the liver sometimes up to the months or year. So it's not that today mosquito has bitten and the next day we'll have fever and that will be malaria. It will take time. Then from the liver, it goes to the blood cells. And when it goes from the liver to the blood cell, then it is leading to the symptoms of fever. So these are the fever spikes which come. Fever spikes come when in the blood cells, these parasites multiply. And when these parasites are there in the patient, that time, if some mosquito means female Anopheles mosquito only because that will spread. If that time that mosquito bites that person, so these through the blood, that they can go to the mosquito, and then mosquito can spread to the another person. So this goes on this. So cause is the plasmodium, but spread is through the mosquito. So if there's no plasmodium, which is very difficult to eradicate, but easy to eradicate or easy to remove or easy to prevent is the mosquito bite. So please take control of the mosquito bite. So what we talked, malaria spreads when a mosquito becomes infected with the disease after biting an infected person. So how the mosquito becomes infected? When the mosquito bites to a infected person or person who's having malaria. Now this parasite, when it gets entry into the mosquito, remains there in the mosquito, gets active. It's not that immediately the mosquito bites to the other person and it will release this parasite. No, that parasite is not infected. So in the mosquito also there is a one definite cycle. It grows in size, it grows in changes, and then only when it bites some other person, maybe after 1 week, then it can spread to the other person. So mosquito becomes infected by feeding on a person who has malaria, and if the mosquito bites in the future, it can transmit malaria parasites. So malaria mosquito bites, it goes to the liver and then it comes in the blood. And it takes time. It takes up to here, sometimes months. And this from liver to the RBCs in the weeks. And then it goes in the mosquito. There also it takes a week. So in the liver, once the parasite enter the body, they travel to the liver and they can remain there for as long as a year. So if somebody had a mosquito bite or maybe traveled to a place where mosquitoes are very common or malaria is very common, maybe 3 months or 4 months back, and then now had a malaria, people feel that time was too long. I visited the malaria place maybe 3 months or 4 months back. Yes, it can happen. Then in the bloodstream, when the parasites mature, they leave the liver, so they remain in the liver. When the parasites only become mature and they can multiply, then they leave the liver and infect the red blood cells. And this is the time when people typically develop the malaria symptoms. So malaria symptoms come when this parasite plasmodium is in the blood, multiplying in the blood. And from there, it can go to the next person. If uninfected mosquito bites at this point in the cycle, it will become infected with malaria parasites and can spread them to the other people it bite. So this is one very important mode of transmission. And we can take preventive measures. Please don't let the mosquito grow, one thing, or don't let the mosquito bite. Two things, very, very important. Apart from this, there are other modes of transmission, which is very less, but still they are there. Because the parasites that cause malaria affect the red blood cells, people can also catch malaria from exposure to infected blood, including mother to unborn child. During the pregnancy, it can have through the blood transfusion. Suppose a donor has a fever or maybe may not have fever at that time, but parasite is there in the blood and the person gives the blood, and when the other person who takes that blood, recipient what we say, that person may get this parasites multiply and it may spread. That's why malaria test is done for all the persons who are giving blood. When we give the blood, we think we have given the blood and the other person will receive it. No, it's not like this. We give the blood, then blood is tested. When blood is tested, checked for 5 infectious diseases like hepatitis B, hepatitis C, HIV, and the malaria and syphilis. So 5 tests we do conduct on this. If all tests are negative, and then we cross matches. Cross match means yes, blood can be issued to the other person. They are matching, their blood group is matching. Only then we release it. So malaria is one of those diseases which can spread through the blood, and we check blood before giving it to the recipient. Similarly, if we share the needle which injects the drugs, that can also transmit. But these are the very minor cases where blood transmission can occur, more of a theoretical part, but practically most of the cases what we are seeing now is it is through the mosquito bite. Now, very important. What are the symptoms of this? Now, symptoms, first very important thing is a fever. Now, fever can be there in viral, fever can be there in dengue, fever can be there in other things also, jaundice, the liver infections. Now, here this is very important. How the fever is there. Fever with chills. And again, there is a fever with chills. Chills means a person feels the cold, extreme cold. And then there are rigor. Rigor means person is shivering. If a person is shivering and person is having fever, person is feeling very cold, using the blanket or maybe the quilt, even in the summer, because the May, when we say the months of the start from the May, June onwards. So in the summer month, person is asking for a quilt or a blanket, feeling cold, having a fever, high grade with a shivering, most likely the person is having a malaria. General feeling of discomfort, any fever can have, headache, nausea. Nausea means a feeling of a vomiting. Person is feeling that person may have a vomiting and person may have a really vomiting. This occurs in any fever. Apart from this, sometimes GI, gastrointestinal part symptoms are also there. Person may have a diarrhea or abdominal pain. Generally in malaria, we don't see, we see in more on in the typhoid or the jaundice here. Along with this, joint pain, muscle pain, feeling of tiredness, breathing becomes fast. Normally, we breathe for a 12 to 15 times in a minute. Here, maybe it becomes roughly 18, 20 or 22, 25. So breathing is fast. And heart rate is fast, rapid heart rate. Pulse rate increases. So if we take the blood pressure, the pulse rate sometimes come 100 plus, 110. So no need to worry. This is because of the malaria or even a fever. Sometimes these persons may have a cough, so we confuse whether it is a viral infection or some other thing. But generally, what we see, a very typical fever with chills and rigor. Rigor means a shivering. And apart from this, people have a malaria cycle, attacks. Means it's not the whole day person is having a fever. Person is having a fever with the chills and rigor and maybe fine for 12 hours or maybe on this same time, almost on the same time after 12 hours or maybe on the next day, person is having similar episode of a fever. If these are malaria cycles, attacks occur, which with the shivering, chills, fever, then the person becomes totally normal and then again comes back maybe after 12 hours or 24 hours. Most likely this is malaria. We do not see these symptoms in a dengue, these cycles, and in the dengue, most commonly what we see, a headache. So malaria means it is in the cycles, but sometimes it may be without a cycles also. So just to revise it, fever, chills, and shivering, as I said, along with the muscle ache, pain in the muscles, pain in the head, person is feeling fatigue, this nausea, vomiting. This means a person is having a malaria. So definitely visit the doctor and doctor will ask for a test. Sometimes it we generally confuse with the dengue and the season also matches because little bit less. It starts in the May, June, but dengue generally we see little later when the humidity is high, maybe towards the August, September, October. So early after monsoon, we see more of a malaria than later dengue, but sometimes symptoms may overlap, sometimes season may overlap. So in dengue also there is a fever, but generally fever is remaining there for the whole day. That is basically a virus. Headache, very important. Headache may occur in any fever, in malaria, in dengue, but here headache is around the eyes. Then it's more likely a dengue. There is a nausea, vomiting. swollen glands, and rashes. Rashes are more common again in dengue rather than in malaria. So, with these symptoms are there, then how can we diagnose it and what are the tests available? Because ultimately the diagnosis will be confirmed only by the blood test, which is malaria. So, if there is a fever with chills, with there is shivering, please visit the doctor, give the history, and if there are typical malaria cycle, then doctor will always advise for a blood test. So, in the blood test, what we are looking for? We are looking for the plasmodium parasite, which is causing malaria. We are not seeing any mosquito bite or part of. We're seeing the plasmodium parasite, whether vivax or a falciparum, then we report it. So there are two very important tests which confirm the malaria. One is called the peripheral smear. We take the blood, again the rapid card test. Again, this is done by the blood test. So what happens? We do take the blood sample, and on the blood sample, or maybe the finger prick or the blood sample, finger prick will spread it on the slide, stain it, and see under the microscope. And when we are seeing under the microscope, as a pathologist, as doctor, then we see whether it is a vivax, plasmodium vivax parasite, or plasmodium falciparum gametocyte. They're totally different. If you see, this is a falciparum gametocyte, sickle shape, which is seen in the blood test, picked up, and this is the plasmodium vivax, which is inside the red blood cells. These all are red blood cells. So very typically, we can make out this, and then we confirm the report malaria positive. It is a plasmodium vivax or plasmodium falciparum. So it's not only malaria positive report is important, it is malaria, which malaria is important, means which is the causative organ, vivax, plasmodium vivax, or plasmodium falciparum. Why? Because in plasmodium falciparum, there's a lot of complications can occur. So we report this, both things. And nowadays, rapid card test is available. It is just like the simple test blood in this card test. And there also we report whether it's a plasmodium vivax or plasmodium falciparum. But more important is the slide test, complete blood count peripheral smear, which we see by the eye, doctor sees through the eye. What about the platelet count? You must have heard of this, that platelet is the cells. There are three types of the blood cells. RBC, red blood cells, WBCs, white blood cells, and third cells are the platelets. Now, what is the importance of platelet? Platelet is important because it prevents the bleeding. So anywhere there's a bleeding, it makes a clot there, so it stops the bleeding. Now, most commonly what we see in the dengue, platelet count becomes low, maybe which is normal is 1.5 lakh to 4 lakh. That becomes a 10,000 or a 20,000. Platelet count can also be low in malaria also. So we need to do the platelet count also. And nowadays what we are seeing, little more the complication, more likely that will be with the low platelet count. So also see the platelet count in the blood. If platelet counts are low, then we need to further see there may be some complications, or we need to follow it up again and again. Maybe twice in a day we need to get the platelet count test. And these platelet counts become low more in the falciparum, which is leading to more complication. So when we are getting the blood test, get the blood test for the diagnosis, means the peripheral smear test, PS for, we say PS for MP. MP is a malarial parasite, PS is peripheral smear, or rapid card test. And the third test is the platelet count, a very, very important even in malaria, just like dengue. So as we said, malaria, normally if vivax is there, plasmodium vivax, it is mild, we give the treatment, person becomes all right within 2 days. But sometimes there are complications, which is more common if it is a plasmodium falciparum malaria. That can be fatal, because especially caused by the plasmodium falciparum, and what we see very common in Africa. So World Health Organization had estimated that 94% of all malaria deaths which occur in Africa, most commonly in children are under the age of 5 years. So children and the elderly, which as such are the population which gets which has a low immunity, actually, their deaths is more common. And malaria deaths, which if we talk, it's not that malaria can lead to the death, malaria can lead to the death also. So that's why we want to prevent it and we want to totally eliminate it when we can do it. And we have seen that so many countries in the world has done it. The malaria deaths are usually related to one or more serious complications. Now, what are the complications? But it's a cerebral malaria. What cerebral means a brain. So this malaria can go from the blood to the brain. So it also called brain infection. So if parasite-filled blood cells block the blood vessels to the brain, inside the brain there may be swelling or brain damage, and this may lead to seizures, coma, convulsions. Person starts having the seizures and coma. So this is the one of the very important complication, and this may be the fatal. The infection, brain infection in the malaria, very severe infection, very difficult to treat it, and one of the very common cause of the death in the malaria. This malaria can lead to the breathing problems because it can lead to the fluid accumulation in the lungs. So if in the lungs fluid gets accumulated, so lungs, what is the normal function of lungs? Lungs expand, and then there is a gases exchange of gases occurs. But if lungs are surrounded by the fluid, so lungs cannot expand, gases exchange, oxygen, carbon dioxide does not occur, and then lead to the low in the oxygen. And whenever there is a low in oxygen, that is again a complication and problem. Organ failure. Malaria can damage the kidneys, liver, or spleen, which can rupture. It can lead to enlarged spleen. It enlarges and may lead to rupture. And if one's spleen enlarges and ruptures, it's very difficult to treat it because there's a lot of bleeding occurs inside the abdomen, and then person is difficult to it's very difficult to save that person. Kidney failure, yes, malaria can lead to some kidney infection, glomerulonephritis, what we say, the kidney damage, and even the liver damage, and all of these can be life-threatening. Anemia. Anemia is, what is anemia? Emia means blood, N means less. So in the malaria, enough red blood cells are not there. If red blood cells are not there, oxygen does not reach to the body tissue. That means person remains fatigued, tired, hemoglobin becomes 5 or 6, which is normally more than 13 in the men and roughly 12 to 13 in the women. So anemia is a very important complication of the malaria. So if there is anemia, person is admitted in the hospital, we also do the test for anemia, that is a hemoglobin. Apart from this, it can lead to the blood sugar low, hypoglycemia. Hypo means less, glycemia means sugar, emia means blood. So that is again a very important complication because brain requires only the sugar. If sugar is less and brain does not get the enough sugar, it can lead to it may result in coma or death. And sometimes we have a medicines which we give for the malaria, like quinine. They also can lead to the low blood sugar. So we need to see whether person's sugar is fine or not. So for the diagnosis, we talked of the peripheral smear for malarial parasite, rapid card test, also get the platelet count, and if there are complications, then we need to do the complete blood count, especially the hemoglobin and the blood sugar also. So this is the various tests we need to get during the malaria part. Treatment, though, it depends on the complications, it depends on the type, so it depends on the report actually. But sometimes I tell you the malaria test in the blood, it doesn't come positive. whether it's a slide test or a card test, but person is having a fever, shivering, chills, and there are cycles. It's a typical history and this typical part. Then sometimes doctor, based on the history, based on the part, also starts the anti-malarial treatment. We try to do the blood test, but if blood test is negative, but doctor feels yes, this is typical case of malaria, we may start the treatment. We have a quinine, chloroquine drug, but that generally for Vivex mild form. And important thing is now we are seeing the resistance. Now, chloroquine is a drug which is used mildly, but the important thing is give it in a proper dose. And this is also lead to the long of term acidity. So sometimes we need to give it with the milk because it is very strong, and we need to repeat it after 6 hours. So please follow the doctor advice. Latestly, we have a drugs which is artemisinin-based combination therapy, and that is very effective. But again, few people do not take properly this treatment, and then we are having a drug resistance, which is like again becoming very big problem. Just like antibiotics, we see drug resistance. Even in TB, we are seeing drug resistance. Even in the anti-malarial drug, we are seeing the resistance. And the resistance means these drugs are not effective. Why these drugs are not effective? Because the persons who are not taking proper treatment, then the parasite becomes resistant to this. This parasite gets time to change it, and then when they change it, this drug is not effective against this plasmodia. So please follow the doctor advice. Please take the proper treatment so that we do not develop the drug resistance, because drug resistance is a very big problem. For antibiotics, it's a very big problem. We have so many antibiotics, and so many antibiotics are now useless because of the drug resistance. And in the malaria, we have a very few drugs. So this is the important. And then there is a drug when we go to the area, suppose endemic area, which is endemic area, we know there malaria is very common. Suppose we are traveling to a place like this, then we need to take some drugs so that we can prevent the attack of the malaria. So we talk to the doctor, and if we are going in that area, we continue this drug for every 1 week. We take one tablet, but we take as a per the doctor advice. And when we say recovery time, generally in the mild cases, which are generally because of Plasmodium vivax, with the prompt treatment, most patients show significant improvement within 24 to 48 hours. So malaria, more commonly we see mild form, and even the recovery time is very good. Person recovers within 1 to 2 days. This dose medicine is little strong, so in the children we need to give based on the weight, and especially the pregnancy, we need to see whether in pregnancy we can give this drug or which drug that will affect. And common side effects, we say GI, nausea, vomiting, so we need to give with some milk or some food. And in some cases, what we say G6PD deficiency, this is depending on the blood test, then they can lead to hemolysis. Now, how will they present the hemolysis? If these patients have a hemolysis side effect, this drug means urine will be dark. So please tell the patients, based on the medicines, if it is caused GI intolerance, so please take with the milk. So we already tell them patients, and we also give antacids, and tell the people, please see the urine. If suddenly after the medicine it becomes a dark, very bloody dark red color, then please stop the drug and report to the doctor, because they may have some deficiency which is leading to the complication or side effect of the drug. So please follow the doctor advice in this, take properly, and if there is any features of side effect like urine features or the GI intolerance that person is unable to take, please visit the doctor. Now, we talked of the various parts, how it causes, how it spreads, the life cycle, the treatment part. Can we prevent it? Yes, very important. We can prevent it. No mosquito or no mosquito bite. Two things. It is based on basically two things. So if you are in an area where malaria is common, then avoid the mosquito bite. They're generally active between dusk and dawn, so where we need to prevent the mosquito bite. How we can do? Keep the doors closed or keep this area like this. Cover your skin. Wear the pant and long sleeve shirt so they cannot bite in the exposed area, especially. So cover your skin. You can use mosquito repellent. Nowadays, mosquito repellents are available. They are even we can apply to the clothes, and especially in the children. We ask when they are going to the schools, we can use this mosquito repellent um, with them. This repellent can be available to the clothing or dress. There are some sprays which can be used, and asks people not to sleep in the open area, sleep under a net. Especially those people who are sleeping in the open areas or where, then we can ask them to use a bed net. And now medicated net is also available, so we can prevent the mosquito bite. Apart from this, eliminate the standing water. Now, standing water is a very important source of a breeding. Now, if in during the May, June, we see generally the coolers, and in coolers we do not change the water, the pad, the mosquito grow there. Sometimes in the fridge, if it's not defrosted or defrosted, there is some water collection and we do not see. Or in the plants, we say some mosquitoes are growing because of the tray under the vase that has a water. So we say make a habit of a dry day. Dry day means once in a week, please change the water or dry it. Why important? Because mosquito, when gives birth to their larva, they remain in the 7 days for the water. If even for a 1 day out of those 7 days we dry it, means mosquito will not grow further. So this is very important. Means this is called dry day for the mosquito. 1 day in a week, please keep it a dry day. So do not allow mosquitoes to breed. So do not give them this water place, basically. Stagnant water, persistent for more than a week, or the water tanks, if it is there, keep the water tank covered. Sometimes we see on the rooftop some waste material is there. There is a rain, and this in the waste water gets collected, and the mosquitoes grow. So again, please take care of the environment as well as the rooftop. Some things are not there. So do not allow the water to stagnate, because that is a very important breeding place. Stay indoors, so don't allow the mosquito to bite you. For that, we can also use mosquito repellent, mosquito nets, and wear protective clothing. So don't allow mosquito to grow and don't allow mosquito to bite. These two things are very, very important preventive steps. Now, one important thing is the vaccine. There are so many vaccines available, like TB vaccine, influenza vaccine, the chickenpox vaccine, hepatitis vaccine. So do we have a vaccine for malaria also? Because it is also infection. So can we do it? World Health Organization has recommended a malaria vaccine for use in children, especially who live in countries with high number of malaria cases. That's more in the Africa, basically. And how much it is effective, but there are continuous research are going on and new vaccines are being formed. But still in India, we are not using any vaccine. I'll just tell you the reason. Malaria is both a preventable and treatable disease. We talked on this. So prevention is like reducing mosquito exposure. Treatment is prompt diagnosis, effective medication. Prompt diagnosis means the moment clinical history is there of a fever, chills, shivering, and their cycles, please visit doctor and take proper medication. Some African nations have begun to use WHO recommended vaccine, especially for the children. But in India, what we see, maximum number of cases are because of the Plasmodium vivax, mild form, and somehow this vaccine is not effective against this. So we do not use that WHO vaccine. ICMR in India, Indian Council of Medical Research, they have developed a vaccine which targets the Plasmodium falciparum, but again the incidence is less. We have to see which cases we need to give it for them. And WHO in 23 also has made a vaccine which is effective against both Vivax and falciparum. India has still not adopted these vaccines. Why? Because we have a low malaria transmission rate compared to the African countries where it is being used. So this was all the malaria. And just a word about the immunity, because if our immunity is low, then we are more prone to develop the infections, any infections. So what is immunity? Immunity is body's ability to fight with the infections. It is like resistance of body to fight infections. It can be inherited or acquired. Inherited, we inherit from the mothers during the pregnancy time, and acquired whatever environment exposure and the vaccine that gives us immunity, that is called acquired immunity. And immunity medically is two types in the body: antibodies or the cell mediated. In the blood cells, as we say, RBC, WBC, platelets. We talk RBC because they carry the oxygen. WBCs, they are important for infection fight, immunity. So cell mediated means WBCs. And we talk about third cell platelets, which stop the bleeding. And in the plasma, there are antibodies which try to kill this bacteria or some other infectious agent. Now, how we can improve our immunity? This is very important. Center for Disease Control USA, which is a very important organization, or very reputed organization, of international fame, that has given guidelines to how to improve the immunity. Because if our immunity is good, then we are less likely to have infections. And if immunity is low, more likely to have infections. So how we can improve the immunity? Eat well. Eat well means eat healthy diet. Now, what is healthy diet? Basically, you can say in healthy diet, eat healthy carbohydrates, especially. Now, what we are eating more of a refined flour, the maida. Refined flour is without fiber, that is not good for health. Rather than what we need to eat, multigrain cereals, millets, that will be the healthy carbs. Have a protein, adequate protein in the form of the pulses, the milk product. The very strong myth is there: vegetarians do not have a protein. No, even vegetarian soya, that also are rich in protein. Restrict the fat and take plenty of fruits and vegetables, because they have a minerals, they have a vitamins which improves our immunity. So healthy diet which is rich in fiber, whole grain cereals, multigrain cereals, and millets, include them, include fruits, include vegetables in your diet. So healthy diet will improve your immunity. And be physically active. Now we are seeing people have become very sedentary lifestyle. People have sedentary lifestyle. Sedentary means they are not doing much physical activity, not even the walk they are doing it, no outdoor game, no playing, nothing in the sort of the activity. So that is also affecting immunity. Because once we are active, we are doing the exercise part, then the whole body blood circulation is there. So all the detox chemicals which are there, they are removed. So activity, the exercise improves the immunity. Healthy diet, healthy, and the remain healthy by through the exercise. And both things will lead to the weight healthy. So please keep weight under normal condition control. So this we can measure with the body mass index, BMI, and BMI means your the weight divided by square of the height. So keep your BMI under 18 to 23, especially in the Indian population. Get enough sleep. That is again very, very important, because during the sleep, it is the body which relaxes, and all the chemicals which are waste products are there, they are removed. So that also leads to improved immunity. And nowadays what we are seeing, people, 40% of the people are not sleeping properly. So we say, please maintain the good sleep hygiene. Good sleep hygiene means take a good sleep. How we can do it? We can do it. Do not have a very heavy dinner. Again, this is a very important part. Nowadays, people are having heavy dinner and they sleep immediately. No, light dinner, 2 hour gap after the dinner. Do not use the gadgets, especially the mobile or the laptop, just before sleeping. Why? Because they emit the light. Now, how do we sleep? Basically, the moment there is a darkness, then our brain gets a signal, okay, this is the time to sleep. But we are using the mobile, we are using the gadgets in the last time, then brain gets signal, no, it's not time to sleep. So these are the reasons we do not get sleep. So please do not use the gadgets or the mobile or a laptop just at least 1 hour or maybe 30 minutes at least just before the sleep. Say no to smoking and avoid excess alcohol. Again, this we are saying nowadays the stress levels are very common and smoking is tremendously increased. It affects immunity, it leads to cancers, it leads to many body diseases. So please say no to smoking. And if you feel that the smoking reduces the stress, no, stress, it does not reduce the stress, it actually further harms you, because the very high level of stress harms the body, very high level of stress harms the body, and the smoking also harms the body. And similarly, avoid excess alcohol. So if we do this healthy lifestyle, eat well, be physically active, keep our weight under control, get enough sleep, and say no to smoking or alcohol, then our immunity will be strong, and that will mean less infections, obviously less malaria and less other infections. People feel, okay, we are talking of immunity, let me take some immunity booster. And we have seen during the COVID time, people have taken immunity booster for so long, and then it was affecting the liver enzymes also. So it's not a silver bullet. No single pill is highly effective. Do not use for long time if you are taking, because it affects health, especially liver. So if you are taking some immunity booster, then please get your liver function test also done. Yes, there are preparation, organic preparation like tulsi, triphala, that lead to the boosting of immunity, but do not as such take the immunity booster on your own. Rather than, I say, you fruits and vegetables, make your plate colorful. That is the actual immunity booster. We have seen this breeding of the mosquitoes. That's why important is the word of the environmental hygiene. Hygiene workplace is a very healthy workplace. So that is important. A regular cleaning, and we stock drying once in a week to prevent the mosquito breeding. Proper waste of discarded items, no spillage or collection of water, especially at the rooftop or the waste dump area, because that becomes a mosquito breeding place. Even a residential area or the office area, that we need to maintain the cleaning or grow more trees. So, friends, we come to the end of this session. Just to summarize it, health is the wealth, and we are seeing malaria, which is a which many countries have eliminated, but still in India, yes, we have eliminated to a large extent, but still it is there. So it is our duty to eliminate the malaria. If there are fever with chills and rigor means shivering, person should be suspected as malaria, and definitely blood test will confirm the diagnosis, which we talked, which various blood test. Well, as per the doctor advice, you take follow up, get the any other test if doctor is saying, if doctor feel there is a complication, and ask person to admit, follow the advice and take this medicine properly, so that the side effects are less, the resistance is less. And personal hygiene, personal protective from the mosquito bite, environmental hygiene, so prevent the mosquito breeding. That these two are very good preventive measures. So no mosquito, no malaria, no mosquito bite, no malaria. So say no to the mosquito and say no to the mosquito bite for the prevention. With this, I wish all of you a very healthy and happy life. Have a great day, and thank you all. And now we have, if any questions, we can discuss it. Yes, sir.
Dr. Saab, good evening.
Yeah, good evening, sir.
What are the extra precautions required for comorbidity patient?
In which cases?
For comorbidity patients, जैसे like having high blood pressure, having high blood pressure or diabetes patient like that.
So sir, the diet is very important role in the high blood pressure. आजकल हम देख रहे हैं we are eating lot of salt actually we are taking. Salt should be less.
अच्छा.
What we are doing is हर चीज में नमक ज्यादा डाल देते हैं और सैलेड में भी नमक ज्यादा. So that we are seeing 4 to 5 times हम नमक ज्यादा खा रहे हैं. So reduce your salt intake. और अपार्ट फ्रॉम दिस अगर मेडिसिन चल रही है तो टेक रेगुलर मेडिसिन, रेगुलर मॉनिटरिंग, that is again very very important, and avoid fried and fatty foods, which is again we are very commonly taking aajkal. So avoid fried fatty food, avoid salt, monitor your blood pressure. That these are the important things.
Thank you.
Welcome.
Hi everyone. If anybody has any questions, please ask. Otherwise, we are good to conclude the session. So I'm assuming no more questions are left. Dr. Vineet, it was a very informative session. Thank you so much for joining in. And thank you everyone for joining this session. Now I am concluding this session.